geja, you know, lots of geja and onions and tomatoes, tin tomatoes. They will go and we will cook that geja. Nice food every day. Sometimes when there is kobo in the village, we buy kobo. If there is no kobo, we just cook our geja. And the mixed farming, in those days we had mixed farming centers. And the mixed farming centers, the officers who were there, their wives, that we used to call them agricultural assistants, their wives will be there, and some of those who have wives there. Otherwise, the mixed farming center workers, that is we used to call them the messengers, or I don't know how we call those people. But anyway, they live there, the caretakers of these centers. And we will eat their dabereng and their durang. We enjoy that. So it was, we didn't have any hang-ups. We just went in and blended, and then we were happy. And we had no problems. So I think that has given me confidence in myself, because I could talk to anybody. We used to go to the Bantaba and talk to, we sit down like we are part of the village. And that has given me the confidence in this, up to this moment.
What really motivated you to venture into this oyster business or dealing with these vulnerable women?
I'm a social entrepreneur, yeah? I like working with people. I like, especially with women, because as an extension worker, you are trained to work with communities. So I think that has left something in me, because when I left agriculture in 1979, I got married, and then in 1983 we had to leave the country, for other jobs. We worked for United Nations in different countries in Africa. That's my husband worked for United Nations, and I was a housewife. And in those days, a housewife, United Nations, if you are a spouse, you couldn't work because of tax problems. So I was always in the house taking care of children. But we had these, in every country we had the International Women's Association, and I always joined because we had coffee mornings every month. In the morning, you have coffee morning, and then, diplomats will come and sit down and have tea and coffee. So, but there was always projects. We always sponsored projects in the community, in the country, wherever we were. And I opted to always be in the project committees, based on my experience. And we did that. So I had the experience of working with projects. Excuse me. So when I came home, we retired, we came home. My kids had all grown up, and they have all gone to college, and some were working, so I had nothing more to do. So that was how I got into this oyster thing. So I thought I should do something with the women, and passing the women every day, seeing them, buying oysters from them, I realized that they needed help. So that's how I started working with them. So
women are considered hard workers, but they still remain poor. Do you think they are not doing enough, or do they simply lack financial and moral support?
You could say that in those days, and it depends on the level you are talking about, really. If you tell me about the level, the local women who are busy in the farm and the markets, I can understand that. Yes, they are there because of the mentality that we have had for all these years, that women are supposed to be at home and take care of kids. So they don't really get to explore their capabilities, because you are restricted. But if you go to the other end, women at a higher level, I think you don't consider them poor. I tell you what, a lot of work, a lot of money women have here are not poor. If only they could if they could gather their money and keep it to themselves, they would say they are not poor. But if you have to take care of the home, take care of the children, pay school fees for the home, for the children, and do all that, you might not have enough. But I think women in the Gambia could be doing much more. Of course, as I said, depending on the level of women you are talking about. But you know what the society is, and you know what it involves. You know the extended family, and you know, especially those who are not educated. There is a limit to what they can do.
In our second segment, we'll look at women in development. There are some women who are taking stance in the promotion of women issues and are considered important. Hence, this 5 days training for trainers workshop organized by the Network on Gender-Based Violence. The training was meant to support guidelines on clinical management on gender-based violence for social workers and police child welfare officers and community nurses. Hadiboch Baro, the coordinator of the network, gave us an overview of the program. This training was one of the activities put in place by the Network Against Gender-Based Violence that seeks to bring together social workers, police child welfare officers, and community health nurses in the front line to manage gender-based violence on psychosocial support. It was one of its kind that was held by the network to train social workers on the prevention and protection of gender-based violence. In that light brought the establishment of the One-Stop Center in August 2013, a multi-agency steering committee which looks at all violence-related issues. Hadiboch Baro of the network said this training will build the capacity and strengthen the existing partnership between the social workers and the network.
This is the first of its kind because we just developed the psychosocial guideline, and that is why this is called training of trainers. But we have no doubt the caliber of participants that we put together here, they have gained adequate knowledge with the facilitators who are both Gambians and non-Gambians from Finland, and among them is a psychologist, have really delivered the subject matter, and we have no doubt when they all go back to their respective offices or health centers or police station, they are going to disseminate this information to their colleagues. We expect them to do step-down training.
I understand that the network have established the One-Stop Center. So how well do you think victims are responding to some of the services available in the center?
The One-Stop Center was established in August 2013, which is less than 6 months. But despite that, we have seen encouraging number of people coming to report there. As I am speaking, we have received the report from the shelter, which have given us about 12 cases have been managed. Some are sexual violence, some are batterings. So people are responding to the call. And because of this training, it's a follow-up of training of clinical guideline management, which consists of doctors and nurses. We expect people to report at the health centers also, where they will be managed by doctors or qualified nurses. In addition to that, when they need any psychosocial support or they need shelter, they would be linked to the One-Stop Center. So we hope in the near future the numbers will increase, as we know that violence against women or gender-based violence, we call it, is happening. It's just that it is covered up.
It's not easy to run an organization. So what are some of the challenges you face in terms of services rendered and making of follow-ups to know that some of these cases are well solved and the victims are well satisfied?
Our role at the Secretariat, which means the coordinator of the Network Against Gender-Based Violence, our role is to facilitate. But really there is someone who is responsible for the day-to-day running of the One-Stop Center. However, we provide support in terms of logistics, follow-up. We provide fuels to ensure that they can facilitate follow-up and they can also answer to the calls of the victims against gender-based violence. Where need be also, we give them financial support. That means to the victim. So at our level, we facilitate and we make sure that we support them in their day-to-day running of the One-Stop Center in terms of fuel, in terms of providing clothing, food, and all those things for the victims. We provide that to them.
Deputy Director Social Welfare, you as the lead facilitator of this training workshop, what is the reason behind organizing such a training for social workers on psychosocial issues?
Thank you very much, Madam Simaha. I think the reason is in 2010, the Network Against Gender-Based Violence did a DEX review on the response programs to gender-based violence and the like, and it was realized that there was a gap, and the gap was there were no protocols or procedures for supporting gender-based violence victims. So people were just doing what they were doing in different ways, so there was no protocols. And the network therefore decided to come up with a guideline, a psychosocial support guideline for victims of gender-based violence.